Hi, this is Dr. Nelson from Freedom Healthcare. This is our second video on erectile dysfunction and Peyronie's disease. Make sure you watch the other one that talks about the cause of the problem and other treatments. This video is about the PRP injection. The other video talks about the extracorporeal shockwave therapy, which is what this machine does. But let's talk about the PRP injection. So first of all, just a little background on erectile dysfunction. If you're over age 40 and you're a man, at some point in your life you're going to experience some level of erectile dysfunction. It's a difficult thing for a lot of people to talk about. It's kind of a sensitive issue, but it's incredibly common, so let's have the discussion about treatment. PRP injections are an isolation of a patient's own platelets. So what we do is we take a patient's platelets out of the blood sample and isolate those platelets to use for the procedure. So the question here is, why does that work? Why do we do that? Platelets are the healing part of the blood. If we can inject a large amount of platelets into, for example, an arthritic knee, oftentimes there'll be improvement, or to a chronic tendonitis, it draws in all those healing factors and it helps heal that chronic injury. In the case of erectile dysfunction, where there is microvascular disease and also Peyronie's disease, where there is a scarring on the vasculature of the penile shaft, the treatments that we use will cause microdisruptions of those vessels, and that's part of this, so watch the other video. But the PRP treatment will enhance the healing and get a lot more out of the treatment course. So let's talk about the procedure itself. We often do this in conjunction with the extracorporeal shockwave therapy, and we do it at the very end. But PRP injection for erectile dysfunction and Peyronie's can actually be used in and of itself as a single treatment. So what we do is we give the patient a prescription for a numbing cream, and they apply the numbing cream to the area, to the penile shaft and right around the base of the penile shaft, at least a half hour prior to arriving for their appointment, but not more than about 45 minutes prior. And then when they get here, we have them apply it again, and then we bring them out and we draw their blood for the platelet sample. It takes about 20 minutes to process the platelets, and so by the time we do the procedure, which is a non-surgical procedure, is just an injection, the area is entirely numb. There will be no physiologic reactions down there, and the patients almost never feel anything with the injections. In fact, afterwards they're like, well, that was way easier than I thought. And we do a series of 5 injections along the shaft of the penis and up at the top of the head of the penis. And these help rejuvenate that tissue, call in all the healing factors, resolve any scarring that's taking place, which is the cause of the Peyronie's curvature of the penis. And then after the procedure, the patient there's no problem. There's no downtime, there's no pain, and that's it. The procedure has an effect over the next days to weeks as it enhances the healing and the rejuvenation of the tissue there. And oftentimes men will have the question, well, how many times do I have to get this done? If you do the extracorporeal shockwave therapy for erectile dysfunction and or Peyronie's disease or curvature of the penile shaft, we do just 1 injection afterwards. If you're being treated just solely for Peyronie's disease, then we do 1 injection, and then there are other mechanisms that will help with the enhancement of the therapy and the efficacy of the therapy. Make sure you talk to your doctor when you come in and have this discussion about what those things are. But occasionally with Peyronie's disease, there'll need to be sometimes just 1 injection, sometimes 2 or 3 before things really start to resolve. And that is the PRP injection and how it enhances the recovery from erectile dysfunction and Peyronie's disease.